Check. I request all the students to occupy the front seats. I request to put your cell phones in silence. Please put your cell phones in silent mode. Hey, lighting the lamp. Dina. I request you all to stand up as the chief guest arrives the venue.
Loyolaவின் ஒளி வீசட்டும் உலகெங்கில் இணையில்லாத அருட்செல்வங்கள் உலகெங்கும் பரவட்டும் நிறையட்டும்
warm morning to one and all present here. The management staff and the students of Center for Medical and Environmental Sciences, Loyola Institute of Frontier, the Department of Advanced Zoology and Biotechnology, Loyola College, welcome
I am longing to see you one day face to face and to be with you endlessly. Lord, how lovely you are to me. Lovely Lord, you are all to me. Lovely Lord, full of purity, worthy of honor and majesty. Lord, how lovely you are to me. Lord, how lovely you are to me. You are bright as the sunrise and fairest of all. Unto you all the glory will be. You are Lord of creation and Lord of life. I will worship you faithfully. Purity, worthy of honor and majesty. Lord, how lovely you are to me. Lord, how lovely you are to me.
Thank you, Zoology Choir. I request everyone to be seated. Let your light shine is the college motto. As an indication of spreading the light to others, I request the dignitaries on the dais to light the lamp. Thank you, sir. Thank you, ma'am. Now, I request Dr. M.C. John Milton, the head of the Department of Advanced Zoology and Biotechnology, to deliver the welcome address.
Very good morning to all of you. At the outset, I would like to thank God Almighty for this wonderful morning. And I would like to especially invite the speaker of today's lecture, Professor Dr. Anitha Ramesh, a leading oncologist of the city. And this is something really very interesting, very useful to all of us, because all of us know, as biology students, the importance of knowing something about cancer. Long time ago, I happened to read a personal account of a Bollywood star Sonali Bindre and her encounter with cancer. So I think through this series of lectures, or you should be able to understand the importance of it, and just to get relieved of the stigma attached to it, and you should be able to play a proactive role to spread awareness among the public. And this is one of the important requisites of every attributes of fresh graduates. So this is something very important, and I think all of you will be able to get benefited out of this. And I would like to thank and welcome the director of Loyola Institute of Frontier Energy for having made this wonderful arrangement for all of us, and in a special way to the coordinator, the convener of the program, Dr. Pushparani, for having made this arrangement for all of us. And I would like to especially welcome all the colleagues and my UG and PG students and research scholars of the department. Hope this will be of a very big eye-opener to all of you to know more and more about this particular issue of our country. With this few words of introduction, I would like to welcome all of you once again for this intellectual deliberation. Thank you so much.
No person was ever honored for what he received. Honor has been the reward for what he gave. Now I request Dr. Selvanayagam, Director of Life, to honor our chief guest, Professor Dr. Anitha Ramesh, with a shawl. I request Dr. M.C. John Milton, head of the Department of Advanced Zoology and Biotechnology, to give a memento. I also request Dr. V. Pushparani, the organizing secretary, to give a fruit basket to Dr. Anitha. I request Dr. M.C. John Milton, the head of the department, to honor Dr. M. Selvanayagam with a shawl. Thank you, sir. Thank you, ma'am. Now, I request Dr. V. Pushparani, the organizing secretary of this program, to introduce our chief guest to the gathering.
Good morning, one and all present here. There is a lot of biography about Dr. Anitha, but we are already running short of time. Already, I will mention only few things and about Dr. Anitha Ramesh. And it gives me immense pleasure to introduce today's chief guest, Professor Dr. Anitha Ramesh. And she's practiced as Patterson Cancer Center in Vadabalani, Chennai, and Apollo Specialty Hospital in Vanagara, Chennai. Fellowship training in Europe and USA, Professor and Head Medical Oncology, Savitr Medical College Hospital, Savitr University, Chennai, Senior Consultant Medical and Pediatric Specialty Hospital, Chennai, Dr. MGR Medical University in 2000, Diploma in Child Health and Royal College of Pediatric and Child Health in 2003, and DNB Radiotherapy National Board of Examination, New Delhi, 1997. She is also members in International Society of Pediatric Oncology, members of European Society of Medical Oncology, members of European and American Cancer Society, and executive member in Indian Society of Medical and Pediatric Oncology. And also she was awarded awards and recognition. Examination, scholarship award to attend the person in convention to be held in USA, Cancer Congress 2014, Dubai. Recipient of Realistic Award of Women in 2018 for contribution in the field of medicine oncology. And also she was awarded in Golden Women in Medicine in 2020. South Indian Women Achieve Award 2020, SIWAA received on 22 December. Corona Warrior Award received on 23 January 2021. And also she was a recipient of the Carnatic Awards. And also published more than 50 publications and abstract in peer-reviewed journals with a high impact factor. She also published paper for medical journals about oncology care, national presentation, conferences organized by Cancer Management Society, an academic conference sponsored by companies on oncology, cancer diagnostic and treatment and management, medical diagnosis and molecular pathology. Her service is appreciated by whole India. Oncology, and also she was academic post assistant, associate and professor in medical oncology for last 22 years in private colleges registered with MCA, and she was principal investigator, country investigator for the clinical trial in cancer treatment and management, and also she was actively involved in clinical trials as a principal investigator for more than 20 trials, high recruitment Sonafi events trials in the world, and also she was doing research project breast cancer and cervical cancer. And she's also teaching university hospital and medical colleges covering oncology treatment, management, molecular oncology diagnosis. She was also actively involved in the corona frontline workers last 18 months. She was provided 5,000 kg rice and the grocery to the cancer patient and survivors, women, children, daily wages, differently abled and migrant laborers, more than 600 individual worth rupees 5 lakhs. She was provided COVID kit distribution to 500 people and Android mobile phones to children of class 9 to 12 standard schools for online classes, and also she was supported education for the 10 students per year. At present, she is a founder and CEO and managing trustee, Freedom from Cancer Research and Relief Foundation and Trust. She was also she treated more than 500 cancer survivors, including children with retinoblastoma, men and adolescents, women with breast cancer and cervical cancer. And also, Dr. Anitha, she's involved in major national TV and speaker in medical discussion in NDTV, Mirror Now, Times Now, Republic TV, India Ahead, News X, India Today, APN News, News J, and local news, etc., etc. With these words of introduction, I request Professor Anitha to minds with fireful talk. Welcome, Dr. Anitha.
Hello, can you hear me? Yes. A very good morning to everybody, and thanks to the management, thanks to Anthony and all of you for having me here. It's my first time in Loyola College. I have passed many, I pass every day almost out of the gate, but I have not got an opportunity to see. It's nice, it's a different environment. Thank you so much. Yes, as we go on to the cancer awareness program, we can have 1 or 2 lights off. So if you see the diseases which is non-communicable, means which does not spread from one to the other, cancer is now become one of the top diseases and almost third after heart as well as, you can all see? Oh, you can see that, correct, okay. So, and it is as per the WHO, it is rising now. That's what one of the staffs asks whether it's rising, yes. It's rising, why in the sense is because if you see the longevity, okay, and it is almost 70 years, people age living till 70 years of age. So as age advances, your chance of cancer increases. Other one. Second, Artha Vishay is that we have a lot of awareness program. Access to healthcare ipo jaasti irukke because a lot of government schemes available. Ella beat pakatle poite hospital poite they're getting checked. Even for interview for a job, you need to do master health checkups. So other patient care, we are able to pick up the cancer and the screening. So the number is high. Secondly, yes, our lifestyle, Western lifestyle with the corona, lack of exercise, sedentary habit, not going to office, and high fatty diet, smoking, drinks has brought the cancer to rise. So these are some of the points which why cancer is rising. All over the world, if you see, and in developing countries, yes, the rates are very high. And in India, if you see the commonest cause, what is the men, any of the students can take this. In men, what is the commonest cancer? In the cancer top line there. Lung is nearby prostate, let's okay, because prostate cancer stage 60, 60 lung is nearby, something related to lung. Mouth, yes, very good. It's oral cavity cancer, mouth, thunder, and up to the lungs. And one word, what is the cause of this cancer? Excellent, that's all. Tobacco related cancer is the commonest cancer in the world today. Now, what is the common cancer in women? Yes, if it was last year, you would have to say what? Cervical cancer. But now, cervical cancer is the Garbhapai Naak It's in the, I'll show you pictures, you see that. But now, as on today, breast cancer is the commonest cancer. So, male and female, and they, yes, breast and female, and then more after that full on stomach. Prostate cancer, you said, okay, but it is less because you have to live to get the prostate cancer. Yeah. These are the common cancers in developing countries: oral cavity, head and neck, lung, breast, cervix, and GI tract. If you estimate 2020, the cases are rising and large number of, you can see the amount of death which is going to take place in 2030, annual increase in the number. So it's a very alarming figure, and we need to do something about it. How we gear ourselves. The main content of the awareness, why do we have to be aware, why do we have to screen, why we need to know is that if you can pick up the tumor at a small size, your lifespan is long. That's one of the. And if you pick up a big tumor, big mass, either in the breast or in the mouth or anywhere, you small, so that live for a long time. Chinna size detection. So what are some of the causes of the? Yeah, you can take this question. What are the causes of cancer? Just some simple common cause. Yes, anything. Okay, if you take 100 cases, hereditary is only 5%. Okay, any other important cause? Anybody can take the question. It's common. Tobacco, already somebody told tobacco. Percent is related to tobacco. That should be the first answer. Next. Excellent. Lifestyle is there. We already told sedentary habit. Next. With smoking, what will do? Alcohol. Alcohol does not cause cancer, but alcohol and smoking together increases the risk of cancer. So add from exercise, diets less than fruits, vegetables, high fatty diet, smoking, alcohol, pollution, unsafe sex, and needle break infection. There are many causes, but all are less. What you said is hereditary or only 5%. Suppose 100 patient irke 5% matto family history or genes. Most of them, the genes are not so. So what are, if you have to advise somebody, what you have to tell them? Lead a healthy life, stop smoking, do not smoke, do not drink. And what is this? Can anybody tell, seeing the picture? What is this? What is the picture says? You don't smoke, and what you should tell? Not to smoke. Excellent. That is what the picture says. It's called passive smoking. Nariya பேர் சொல்வாங்க, I am not smoking, why it has happened? How does ladies in the family get cancer? That's called passive smoking. One person smoke, you inhale the smoke and you get the cancer. So that's called passive smoking. No to alcohol, no to drugs, and normal diet, lot of fruits and vegetables, and exercise is very important, and the cancer awareness. So one should be aware of this cancer awareness and how to pick up the cancers. Not all cancers can be picked up, but few cancers can be picked up. So screening should be done, and screening means ella cancer pick up panna mudiyadhu. Only 6 cancer. One is breast, lung, oral cavity, cervix, prostate. We can pick up prostate. Cancer pick up panna mudiyadhu. Cancers, ovarian cancer, அந்த மாதிரி பண்ண முடியாது. Only these 6 cancers can be. So breast, colon, rectum, cervix, prostate, mouth and skin. Okay, this is from the trust. Okay, next is coming to head and neck cancer. So head and neck cancer means inside the mouth, since there are so many. Now this cancer awareness program is not for men, women, boys and girls, it's for everybody. So what you learn today, you have to go back and tell your neighbors, tell your friends, tell your family members. பக்கத்துல வீட்ல இருந்து ஏதாவது பிரச்சனை இருக்கு, you should be able to give some general information. You can always say that you are in a college and you have heard an awareness and you are aware of it. Nobody can say you are not aware of it. So this is one of the features of the persons having an oral cavity cancer. So how this cancer has developed? Pan, parag, bidi, chutka, they will keep it in their mouth and keep on chewing for a long time, and they get this. So what is first to be done is to quit tobacco and stop smoking, and that's what the first thing which is needed. It also caused by a virus which is called human papilloma virus. So virus, tobacco, alcohol, unhealthy hygiene all causes the cancer to develop. And this is another cancer patient. This is it comes. So a mass develops there. It starts growing. It starts infiltrating, and then it will spread to the nodes, and then it will go to the lungs. Okay, so at any point of time, smoking is to stop. Now quickly to all the boys who are particularly talking, what way you can do for stop smoking? Anybody? Okay, ban tobacco. Yes, tell me. Nicotine patches, very good. That is to quit smoking, those who are long smokers. Yes, nicotine patches. Next. Anybody? Give me 10 points of no tobacco. Mindset. Yeah, once you are addicted to it, nicotine patches, mindset. No smoking campus. Colleges, schools, public places, government stop, banned. You cannot smoke. Even in movies, theaters, malls, smoking is not. That's one of the big. Some more points all of you have to tell me. Excellent. To raise the price so the tax is more, so you buy less. Next. So many things. What happens in movies, TV? All Tamil movies, people drink and smoke. They write it small. Actually, we should write big. Don't smoke. They will write drink and smoke, but the movie is going on. So that is also all social media or all these things, screening, you should write smoking kills. And when a movie starts, did you see the first 1 or 2 slides of the movie? They talk about the cancer. So that is one thing. So how, once the cancer is developed, yes, you need to come to the doctor and do a biopsy. Yes, scans has to be done, and these are the type of cancer. It can happen anywhere in the whole area, head neck cancer, and it's a normal epithelium. Multiple exposure to tobacco or any other ingredient causes change in the epithelium. I think all of our biology students, they will know the cells undergo dysplasia, metaplasia, carcinoma in situ, and then it becomes cancer, and this shows what happens in pathology. How do we approach? Yes, we need to do a biopsy. This cannot be treated in small hospitals, either government hospital, tertiary center, and all medical colleges do have cancer wing, which will help to treat. The treatment will include, yes, biopsy. Can you see all these tumors? Just to give you an idea, or if anybody nearby comes, says, vaayulla katti irukke, valli irukke, nariya sali vandute irukke, ratham vandute irukke. So it's not that you're going to diagnose, but you should be able to guide them. Yes, it can be cancer. Please meet the nearest doctor, have a biopsy done. Nariya pair will go to dentist. So we should not miss it. That's what it is. So once it is developed, we have to start treatment. Test molecular testing. I told you a virus is involved, human papilloma virus. I think all of you will be aware of it. And many of the research is also going on in biomedical sciences, looking into the virus. The advantage of the virus is there is a vaccine which we can give to adolescent college going. It's there in US, not yet approved in India. But for girls, we are giving for cervical cancer, but not for men. But in college students, all in US, they get this vaccine, human papilloma vaccine, because for their oral sex and for the human HPV. So yes, we want to prolong the survival because the curve. So yes, we do have treatment. We have newer methods of radiation, surgery, as well as chemoimmunotherapy. The past was bad. People died. People progressed, but the present we have all amenities, even in the government hospital, and this is covered by the Tamil Nadu government schemes. So basic treatment of biopsy, scan, chemo, radiation. So no patient will be without treatment at this point of time. But namakke, periya treatment venu, I want immunotherapy, other things, then in such a case, particularly when the tumor spreads, suppose perviature, local recurrence, then the cost comes in and you should not go up to that stage. You should not come that late when the expenses are too high and people will be in needing. And that's the radiation machine which gives the radiotherapy to all the patients with the head neck cancer. Yes, I told you basic treatment gets covered in all the states of India. Ayushman Bharat, it is covered. And even so, if you don't have any finances, but still you can get treated in the state, so nobody should be without cancer treatment. Before we move on from tobacco, again lung cancer, just few lines of lung cancer. It is also caused by tobacco. Patient will come with cough, sali, much kashtam. At later stage they will have pain. Okay, they will have rattam varo salilande, bleeding from the cough. And if you come very late, then in such a case, you might have brain mets, liver mets, and spinal mets will be there. So, and screening is there. We do low dose CT scan for people who are a chronic smoker, 20 packs of cigarettes per day. 10 varsham, they are continuing. For them, you have initially ille, but you can do a CT scan to detect whether early stage of cancer. During COVID, many patients we did CT scan for COVID. Nadiya lung cancer was picked up because they just came for COVID and it was seen in the CT. So, common cancer in women, we will go breast, ovarian and cervical cancer. This is the breast tissue. Breast has a lot of fat and glands. The cancer arises in the glands, not in the fat. So it abnormal cells. Now quickly, one quick question to all of you. What is these cancer cells? All will be biology. And can anybody tell me what is cancer cells? Actually, we should have asked earlier. Anybody? Yeah, please. Contact, and they have uncontrolled abnormal growth divisions. Yeah, abnormal divisions. Usually one cell will divide into 2. Over here, one cell divides into 10. 10 divides into 1,000. So uncontrolled, and they don't stick to each other, and they get into the blood, they start spreading. So that's abnormal cells out of control. And if you see breast cancer is more common in the cities, metro cities like Chennai, Delhi, Mumbai, whereas cervical cancer was more common in the rural areas. So early detection helps. So what you need to do is to find out. It is not that we are boys and we don't want this, but you can be able to tell for your mother, for your sister, for your aunt, for your grandmother. You should be aware. At least guide them in the Madari Vandachi, go and meet. Sometimes the size of the breast will alter. There will be nipple discharge, retraction, thickening. See, like this abnormal position of the breast, puckering, the breast bulle breast velile varo. So these are some of the pictures which will guide us. Yes, we are not dealing with a normal breast. Suppose somebody in the family solitaire in the madari irukke, please guide them. Don't wait. And many people do Ayurveda and all, and the time they don't diagnose and they treat, so you lose that particular, because breast cancer is curable. Stage 1, 2, 3 we can cure. So again, early menstrual history, not having children, not breastfeeding is very high risk factor. Apart from obesity, there is a family history of this thing. What is Angelina Jolie? Somebody said genes. Somebody was saying anything? What is Angelina Jolie effect? One of you told me about genetic factors. Yes, tell me, who knows about something? You tell, whatever you know, it may be wrong also. She removed her breast, very good. What else she removed? Bilateral breast. She also removed her uterus and ovary next year. Why she removed it? Is she a cancer patient? Yes, excellent, very good. She is not a cancer patient, but not only she, multiple members of her family had breast cancer and ovarian cancer. It is called breast ovarian cancer. When she did the genetic testing, it was BRCA, positive and 2. So it runs in families. If 100 women are diagnosed with cancer, 5 of them will have this gene. If you have the gene, then your first degree relatives like mother, own sister, akka, tangachi, party, same blood relation should go for screening. So same thing was there with Angelina Jolie. She did not get cancer, but before cancer can affect her, she removed her breast. She also removed her uterus and ovaries. So she doesn't have any of these organs, and because she wanted to live and she wanted to be. And that's the big news in the papers, and it is called Angelina Jolie syndrome. In India, women are diagnosed with BRCA1, but we practice we'll remove the breast. You remove the breast and you can reconstruct the breast. So adake bhayam kadiyade. Ovaries remove panite, ovaries reconstruction panna mudiyade. But you can keep the uterus for your carrying the child. So this is just in relation to this, because breast cancer is related to genetic. Many of you told. Yes, mammogram needs to be done for screening. Radiation, chemo, again, Anthony wanted to know with the government scheme, Tamil Nadu, present government, and it's coming down, Jayalalitha, Kalingar, all schemes covers major treatment for breast cancer. So you should not go out of treatment. Tertiary hospital cannot be treated. Chinna primary center in the Panamudiyade. You have to go to a medical college, and any tertiary hospital will offer you. Scheme is available, use it. But is what we need to know is to have to guide the patient properly. Please go and get the treatment. It's treatable, it is curable, access is there, and everything is available in our country. Cancer prevention, yes, what you should do is that breast self-examination, it should start from the age of 25 to all the ladies. Okay, you should stand on the 5th day of your menses in front of the mirror, see your breast, feel your breast, and when you're taking bath, feel it. 2 minutes per month for the rest of life. For men, please go home and tell your mother, tell your party. Mother party may be just, they can do it 1st of the month, 1st November, 1st December. If you are menstruating, on the 5th day. If you are not menstruating, 1st day. Teach them. We need to meet the doctor. That is to be done for everybody. Look, stand in front of the mirror with your hands on the thing, hands up. Standing position, sitting position, and lying down position. That is called breast self-examination. Everybody should know. for all. The whole population should know this is breast self-examination. எல்லாருக்கும் எப்படி இதை palpate பண்ணணும். And any abnormality, you have not to keep quiet, you have to meet. 40 வயசு மேலே mammogram, both ultrasound as well as. So that's about breast cancer. Anybody, any doubt about breast cancer? Anybody has any relative with breast cancer? Just you can share your experience so others will know. Bad experience, good experience. Yes, Anthony will tell.
Actually, in the past 2020, my mother was diagnosed breast cancer, and we were taken to ESA hospital, and ma'am was the doctor who cured my mother. She had multiple breast cancer in her breast, more than 6 tumors she had, and she guided in a very good way. And we are very much, I'm very much impressed to have her as a doctor. She gave a proper treatment, and she got this cancer using, I don't know what was the source. I think so. I think it can be a carcinogen problem also. So she had multiple tumors, and she gave a proper treatment, surgery. We did surgery. We did chemotherapy, 8 cycles of chemotherapy. We did radiotherapy, and currently she is undergoing immunotherapy. So I thank you, ma'am, so much.
Thank you so much. So we hear from each other, we learn, and then if somebody has somebody in the family, relations, college, office, we should be able to guide, tell them is that cancer is not the end of the journey. Yes, we have long way to go. Okay, with this we move to cervical cancer. Cervical cancer was the commonest till 1 or 2 years back. It was to occur mainly in rural people. And then நம்ம பாட்டி எல்லார், if you ask them எவ்வளோ குழந்தை 5 6 10 சில பேருக்கு சொல்லுவாங்க. So there you had vaginal delivery. Many of these ladies had cervical cancer because multiple, and they will get married early. So some will have unhealthy sexual practices, infection, multiple childbirth. And remember, Tamil Nadu is one of the states in the whole India has the maximum number of cervical cancer. These are the states. Puducherry. Again, virus causes, human papilloma virus causes this, and along with this. And this is the area where the cancer happens. This is the uterus, and this is the outside vagina. This is cervical cancer. Okay, so that is the area where the cervix takes place. As I told you, viral infection, multiple partners, early sexual intercourse, okay, and using hormonal pills to avoid pregnancy, all causes. Smoking even causes to. Sometimes use of condoms can prevent it, but in olden days we did not have these facilities, but we do have now. So early stage, and this is also a curable cancer. It goes slowly, it can be screened. So screening starts at the age of 25, and everybody should have a pap smear once you are sexually active. Once in 3 years, negative irke, once in 3 years mattum pannanom. You can get cervical cancer even up to 50, 60. So usually they will come, ipdi varo, vali varo, bleeding varo, and they will have white discharge. In between menses bleeding varo, they may have foul smell, and particularly also after sexual intercourse, many ladies will say it started bleeding. So that's not a good sign. Okay, so you need to look for the cancer. And it starts like this small area, it starts growing, spread out and then spread. Once it spreads like this in the urinary tract and the motion, you may get bleeding in the urine, and you may get bleeding in the motion, and it's very advanced, you should not go. Human papilloma virus, these types are associated with the development, like how it is in the oral cavity. How do you diagnose? Yes, biopsy is needed, either curettage, and one of you told the cancer cells. Now this is how precancerous cells look like. They have abnormal. Anybody can describe the cell? I want some of the girls to speak also. They all spoke. So many girl students are there. You can see the picture and describe the cancer cell. Anybody? You can tell how does this, not looking at it, how does a cancer cell will look like under a microscope or anything? Yes, anybody can. Yes, please. Yeah, cells are abnormal, very good. The cells are abnormal nuclei, abnormal nucleoli, multiple nucleoli, atypical spindles, altered cytoplasmic nuclear ratio. That's how it should be. It will look very bizarre under the microscope. So automatically you can pick up they are not normal cells. Okay, thank you. So pap smear can be done once you are sexually active. You can do a biopsy. Okay, and these are how to do the biopsies. Now, quickly, what is cervical cancer vaccine? Has anybody taken? Okay, it is available by the government. Now it is approved. It is from the age of, after you finish your pediatric vaccine, the pediatrician finishes at the age of 14. After that, the pediatrician gives the vaccine to girls, particularly when you're going to college. Class 12, Murunjichi, you're getting admission into colleges, you can take the vaccine. Or it has to be before sexual intercourse. If you had a sexual intercourse, you can take the vaccine, but the effect avlo kadiyade. So best age is prior to going to college. It's approved by the government of India. There was a news 1 month back that I think one of the vaccine companies are making it. It's quite cheap. Till now, foreign companies. So please take it. This will prevent you 70% time from cervical cancer. So it's one of the vaccines to prevent cancer. It's to be used in women from 9 years and abroad, but nama oolle 12 okay, 12 to before you go for. You can take it up to 45. Nariya pair who don't get married, don't have intercourse, apro 45 varaku use pannano, but usually adolescent, college going. So if you have not taken, you can talk to your doctor. It's optional. If you want, you can take it. Yes, treatment is possible. Surgery, radiation, chemo, survival. First stage length survival is in 90%, and later stage the survival figures decreases. Cervical cancer vaccine, try to take it if possible, and it can be given in young girls, women, provided before sexual intercourse or before marriage. Okay. So that's about cervical cancer, and it's curable. Again, cervical cancer usually does not have surgery because you cannot take it out. Usually chemo and radiation, even stage 1, 2, 3, all are curable. Any doubts about cervical cancer? Anybody wants to share some experience or known person has anything you want to say? Sir, you can also put in your thoughts. Okay. So another rare cancer in women, it is not screenable. That's why patient comes so advanced stage. The whole abdomen is full of fluid, and there's an advanced cancer in this patient. So you should not come at this stage as on 2022 with so much of facilities available. So, and this is difficult also to diagnose because inside the abdomen the tumor grows, and the treatment is recommended. And so just I showed the picture because ovarian tumor is not screenable, but yes, it is advanced cancer, nothing can be done, we have to send you home. We can push the death for some more time, not beyond that. That's it. So come early. So the screenable tumors are oral cavity, lung, breast, cervix. We did not discuss about colon. Yes, colon can be done, stool test, prostate, PSA, skin cancer. Skin cancer can be, or apart from this, other cancers cannot be screened. So I usually tell all my patients or anybody, do a master health checkup. Even for children also now you have pediatric master health checkup, adult, adolescent. It will pick up early diabetes, it will pick up cholesterol. Many college students have diabetes now. I have patients at 20s with cervical cancer, breast cancer. I have college going boys with lymphomas. So now the number, with the younger ages, cancer is seen. Many young people in 20s are having cancer. That's not pediatric cancer, but it's adult cancer coming early. So get a health checkup done. It's not very expensive, and in government colleges it's free. And it's very minimum cost is for everybody. Once in a year you should do, because if something is picked up, you can cure it. Did I confuse you? It's so much, and I might have frightened everybody with the pictures also. So yes, but one needs to know about it. Okay. Many things have changed over a period of time, and now we are in a better position, and we can tell cancer is curable, but you should not come late. effective communication, awareness, we should help each other, and that's why all the other modes of cancer communication is going on quickly. But this may be the last question. What are the different modalities of ways that government or public is trying to prevent cancer? We have already told about tobacco. We told no smoking in campus. Somebody told that passive smoking. You told about nicotine. Okay, don't drink alcohol. Some 5 points, another 5 more points I want. What somebody you told about the price. The price is high, tax is high, but government cannot mandate because other logistics are involved. We have 6 points we told. Some other 4 points, important points before we conclude. That's excellent, vaccination. One is cervical cancer vaccine and another vaccine is hepatitis. So hepatitis vaccine, if we take, it will prevent the hepatocellular carcinoma. Male, we finished, they already answered. It is tobacco-related cancer, oral cavity, head, neck and lung. That's what she also raised the things. Prostate occurs at a very quite rare, 1%, but now the cases are rising because men is living longer. And some of the other points, you have designated smoking areas in movie halls, then movie caption goes on. What are some more points you tell? Cancer awareness in school, colleges, you see in the newspapers, screening programs running. If there is a free running, please go, newspaper ads, caption, TV, media, social media, networking, everywhere it should be a part of every curriculum that helps you to prevent or make aware that you are is there and go for screening and help you. And the government schemes are available which will help you to complete your necessary treatment. So effective communication, and that's why today we are here for the cancer awareness program. And that's all I can say from my side. Thank you very much. Any questions we can answer? Sir, any questions from your side? Yes, sir.
Based on the cosmetics related to cancer,
Cosmetic surgeries you're talking of, use of cosmetics. Use of cosmetics as on today is not non-carcinogenic. Just remember one most important carcinogen in all over the world is tobacco. Next is asbestos. Next is some of radon, some of the pollutants. Remaining, even pesticide is not that much. So only 5 or 6 carcinogens has been identified. Rest are all in research, nothing. Even they say mobile phone you will get brain tumor, but not established. So cosmetics, none of the materials used causes any of the till date not proven. So yes, yeah ma'am. Yeah, the talc. Cervical, no, ovarian cancer. Talc is known. Talc is known because what happened, women used to put powder and they will put the powder on the pant and they will wear. So what happens, this powder goes up, okay, and it will block the tubes and that caused ovarian tumor. But talc is known for ovarian tumor for a long time. Johnson & Johnson makes that powder. So that way they have related. Again, powder is not. That same powder if you apply on face and all is not carcinogenic. Not carcinogenic. Yes, somebody wanted? Suspected as, yeah. Can set the cycle on. Set the cycle on.
So how effective is Ayurveda, Yoga, Siddha, Unani against
Yeah, so yoga I will tell you because I'm not trained in Ayurveda, homeopathy, and I'm not here to comment about any other branch of medicine apart from which I'm practicing. But yes, yoga is a part of everybody should do yoga, breathing exercises. It has so many positive effects of blood circulation, organ wise, and improves. Regarding definitive treatment, allopathy is only proven. Ayurveda, yes, we don't stop patients from doing, but don't do two things together. You should not take chemotherapy and take a natural medicine. Yes, once your treatment is over and you feel that you don't want, take the alternative. So we do promote complementary medicines, but when your things are exhausted and patient does not want anything, family does not want, cure as such has not been documented with any of these things. There are anecdotal reports that they have taken, and based on that, in a bigger forum, it's not better not to comment. But yes, allopathy, I can comment that it's curable, highly curable. No, no. Any other things? Yes, please. Correct, correct. See, direct association is not there, but then we tell avoid plastics. None of the ingredients in plant, not like tobacco. We can say ban plastic, but not for cancer, but for other things, for environmental warming, all those things. It's one of the thing which has caused a lot of havoc. So we say ban plastic for other reasons, not for cancer, but might have indirect cause. Okay, but not an established carcinogen. Plastic is not an established carcinogen. Like mobile phone is not an established carcinogen for any cancer. Yeah. Fibroids, many of the women have fibroids from early stage. It will cause pain, it causes excessive bleeding. It's one of the cause of infertility after marriage if you don't get children when you do the scans. So fibroid is usually non-cancer. It's a benign tumor of the uterine wall, and it doesn't usually turn to cancer at all. Yes, fibroadenoma in the breast. Again, many of the college students, we have students reporting in colleges coming with lumps inside the breast. Yes, fibroadenoma, again benign, need to follow up, but you should not miss thinking it's fibroadenoma. Fibroadenoma, very rarely, like fibroid, 1% chance to become. Many women live with those fibroids for years together. Yes, sir. Cancer is primary, secondary, tertiary. Okay, primary means it originates from one particular site, like from the breast, it goes to the akal, that is the axilla. Okay, primary originating, this will, a pathology report will tell us where it is. Secondary means, suppose this breast cancer, marva putrunai, lungs will perviache. You do a lung biopsy, same histopathology, and the special testing irke. Adalinde nama theriyo secondary. Secondary means namakku primary vera place lende inge perviache. Tertiary, I'm not aware of, sir. Primary and secondary. Primary means main site of origin. Secondary means inge parviyachi. That can be brain, bone, lungs, liver, anything. That is secondary side. And secondary side detect it's the last stage, stage 4. So any for all the students, anytime, it's a very good question. Secondary means it's always in the last stage. It has come from the primary and got into the blood, and it is circulating in the blood. Yes, tell me. 70%. And not all strains. 16, 18, 31, 33 matto is cancerous. Other strains not cancerous, and only 70%. And the vaccine gives you 70% protection. It cannot cover all strains. Yes, please. Chemo drugs, yeah. So every cancer has its own standard of care, chemo drugs, which has been proven. Breast cancer means rendu marandu, adriamycin, cyclophosphamide, 4 cycle muchite, attu marandu, Taxol, continue panana. So it's a standard of care. Some cancer or 80% will respond, 20% will not respond. Adanala bhayom. we cannot control 100%. So we have to go to the second line. Now the treatment guidelines are very clear what medicine is to be given for what tumor. Okay, you have to follow the guidelines because they are proven. Cancer cells are very intelligent. They bypass treatment and the cancer comes back even after chemotherapy. So that's why many biotechnology researches are going on to do on the cell culture chemotherapy sensitivity and give it when, yes, and chemotherapy sensitivity and give it as per the report.
Now, what about the cobalt 60 treatment? Which type of cancer disease for the cobalt 60?
We showed now quickly it's radiation, it's cobalt. What he's asking is radiotherapy. Cobalt is the old machine now. We don't use, it's obsolete because it has a lot of side effects. Newer machines have come. It is called the photon therapy, and you give it in breast cancer, you give it in cervical cancer, you give it in head neck cancer, you give it in lung cancer. It's a localized form of therapy where the radiation kills the cancer cells at that particular area. Almost all tumors will have radiation. Now, that's what they call in this thing. Yeah, Kadurvich. Cobalt was an older machine, but now we don't use. What you said is correct. We started with cobalt. Now we have moved to newer machines, and in Apollo we have the proton also. That is the latest generation. I think we are done. Yes, please. Yeah, blood cancer can be different types, myeloid and lymphoid. These blood cancer come in children, 3 years, 4 years, and it is highly curable. One of the curable malignancy is leukemia, which happens in children. And so rates around 70-80%. But if this blood cancer occurs in an adolescent or an adult or elderly, it is difficult to treat. Transplant veno. Always chemo, there's no role of radiation or surgery. And cello cancer, nalla treat panna mudiyuma. It is curable like CML, pediatric ALL, pediatric AML, but adult ALL panna mudiyade. Suppose 40 vayasula adhe cancer vanduche kashtam. Acute myeloid leukemia, very difficult to treat, is incurable. But chronic lymphoid leukemia is curable. CML is curable. CML any age vanduchu, that's chronic myeloid leukemia, it's highly curable. Mainly all are drugs based, no role of surgery or radiation. I think I spoke lots. Thank you very much. Anybody wants to make any comment? Why don't you say something on the second row? Just a few summing points. Yes, yeah, please. A few points. No, just nothing. Just we all want to learn from each other. So can you just throw a few lights on this thing?
I read that I thought cervical cancer is the most common one, but I learned that breast cancer.
Yeah, some more points you want to enlighten us. Okay, thank you very much. Thanks, I enjoyed your company. Thank you so much.
Thanks a lot, ma'am, for enlightening our young minds with your inspiring words. Students, we are happy to have Dr. A. Charles, a deputy principal in our midst. I request you, sir, to please come on the dais. I request Dr. Selvanayagam, Director of Life, to honor our deputy principal with a shawl.
So I am here just to congratulate the Life as well as the Department of Zoology for arranging this very useful awareness program. Congratulations, sir, Silverine sir, and then ma'am. Second thing, on behalf of Loyola management, I thank Dr. Anitha, Ramesh. I'm sorry, ma'am, I came in the middle of the program, but the second half session, when I listened to you, it was an eye-opener. Rather than cancer being affected by a person, that the psychological effect the person is undergoing, that he got the cancer, is much killing the person. And you might have attended many programs like seminar, workshops, guest lecture, orientation program, but this one is different. This, all of you have a responsibility now, each one of you, I see. You have attended this session, you have listened to ma'am. She passed on a message. You have to take this message to your family, to your friends, as she rightly pointed out at the end of her talk. Then only the success of this program, the purpose of visit will become more meaningful. But see to that you pass on the correct message. She is responsible for what she has told here, but you should have taken it the correct things and then you should pass on the message correctly to your family and friends. So once again, I thank you all, and once again, I thank you, ma'am, for inviting me for this program. It is really very, very useful. Thank you, sir. Thank you very much.
Thank you, sir. We have come to the end of this program. Now I request Dr. Balachandra, Assistant Professor, Department of Advanced Zoology and Biotechnology, to deliver the word of thanks.
The thankful heart opens our eyes to a multitude of blessings that continuously surround us. James Frost. I, on behalf of the organizing committee, feel proud and happy to propose the vote of thanks for the following people. Yes, let me begin my vote of thanks to the Lord Almighty. He has given us a wonderful Saturday to make it a grand, successful Cancer Awareness Day. Let us also remember and thank our rector, principal, secretary for their continuous support and help given to our department. And also I like to thank wholeheartedly today's guest speaker, Professor S. Anitha Ramesh Madam. You stood here as a cancer warrior, highlighting the number of cancers that human undergoes. Really, we enjoyed. You have thrown light on cancer biology. It is very apt, and our students definitely would have taken into their consideration, and they will spread the awareness to the multitudes, madam. And also, one small GK for you. Is there anybody born on February 4th? Feb 4th? Birthday falls on February 4th? Not February 14th, I'm asking February 4th. You have to remember the day. The day is celebrated as the World's Cancer Day. The theme of this year is Close the Care Gap. The theme of the cancer awareness is Close the Gap, Close the Care Gap, Triple C. So kindly bear this in your mind and spread the news for the many people who come across in our life. I also extend my gratitude to our convener, Dr. M. Selvanayagam sir, Life Director, who meticulously plans and designs the programs for our college. We feel proud and happy, sir. Please keep it up. Then I like to thank our HOD, Dr. MC John Milton, who also wholeheartedly supports all our departmental activities and who continues to support us to conduct this kind of very informative sessions for the students community. Let us extend our sincere thanks to our organizing secretary. It is Dr. V, our Pushparani. Really, it's wonderful, madam. You have meticulously planned the topic and made our people together. This would have been a grand program if you would have called all the lady staffs also, other students also for this particular venue. So that would have been given a lot of information for all of them. Definitely, maybe in the future, we will plan for the mega program day, ma'am. Thank you for organizing such a wonderful program. So, a special thanks to the organizing committee members. They are the warriors of this cancer biology, along with our army commander. Army commander, no? Here we have our Dr. B. Pusparani, ma'am, under whom the, the organizing committee members, they work tirelessly, plan meticulously, and make it a successful event. So great thanks for all the organizing people. And word of special thanks to our beloved students, community. Without you, it is for you, we people are working. So you are the future. You have to bear in mind today's theme. Create the future without cancer. The time to act is now. Thank you once again, all of you. Have a great day. Thank you.
Thanks a lot, sir. Students, this program is streaming live on our Loyola College website, and some of our Ethiopian students are also watching live in Ethiopia also. If you have any doubts or if you want to refresh, you can always go to our college website and see this cancer awareness program. I request you all to stand up for the national anthem. Thank you, one and all. Students.